Put it live. Okay, welcome to the meeting of the Social Services Committee. Deputy Majority Counsel, could you please do a roll call?
Sure thing, Mr. Chair. All right, Mr. Fine,
Here.
Ms. McLaughlin,
Here.
Mr. Brewski,
Here.
Smith, all right. Mr. Simpson,
Here.
Ms. Lockhart,
Here.
Mr. Cleary,
Here.
Mr. Purley,
Here.
and Mr. Commisso, who will be joining shortly.
Thank you. First item on the agenda is approving the previous minutes. Is there a motion to approve? Mr. Cleary, second Mr. Brewski, all in favor?
Aye.
Opposed? Pass unanimous. Okay, now on to current business. Item number 2, authorizing an agreement with Trinity Alliance of the Capital Region Incorporated regarding the provision of family and neighborhood resource center services. Ms. Manning?
She's on mute.
Thank you, Chairman Fine. I would like to respectfully request legislative authorization to renew the contract with Trinity Alliance for the Family Resource Centers. These Family Resource Centers are funded through the COPS funding, which comes from the New York State Office of Children and Family Services. These are community options preventive services. So these are preventive services that have been in existence since 2008. The county doesn't have any type of, because they were in existence so long, the money automatically goes to Trinity because they were an original COPS funding. In 2021, this actually will, in this September, will end. They're actually combining in this new budget, if it passes, the COPS funding and the STSJP. So therefore, their contract would end in September of 21. But the Neighborhood Resource Center is an opportunity to bring all services under one umbrella and provide them to the community in the South End. They do such things as clinical intervention, they do therapy, they have case management, advocacy. They actually run some educational groups that include wellness, literacy, job preparedness. And, again, they really try and get community members to come in and support one another, building that, strengthening that community. In addition, they operate food pantries and after school and summer camps.
Great, thank you. And I'm curious, when this changes in the state budget, so next year, how will that change the Family Resource Center?
They're still providing guidance because with the Families First Preservation Act, there's programs need to be evidence-based. So I think the state hasn't decided as of yet, but what they did indicate was that they are combining the funding of STSJP and the COPS. So I think it will be some type of preventive service, but it will need to be evidence-based.
Okay, thank you. So it may stay the same or similar, but they might be just based on evidence. So some things will likely change a little bit.
I think it will change. The guidance that we just received this week had indicated that the current providers of this service since 2008 would continue until September of 2021.
Okay, thank you. And are there any questions from the committee? Ms. McLaughlin?
Yes, I too had some concerns about what the next format. So you're saying it ends in September 2021. Is that correct?
Yes. Well, the monies will be combined. So that will be dependent on how the state will give us guidance on what it can be used for.
So does that mean that Trinity will not be sort of like the lead agency? And would they have to reapply, or would other agencies at that point be able to form that partnership with the other entities that you named?
Right. I would believe it would be a partnership with the STSJP and what programs they could provide to keep children and families safe in their communities and, avoid an out-of-home placement. That's really the focus. And if there is a need for taking a child out of a family, what supports and services can be in the community that can assist foster parents and kin.
So that sounds like that's just one portion of the program that Trinity does. This STSJ, is that what you called it?
STSJP, they actually don't provide services for STSJP. That's actually going to be another agenda item here, but that's the juvenile supports for children that are involved in the juvenile justice system.
Okay.
And a lot of that funding also goes to reintegration of children back in the community, as well as our probation partners.
Okay. All right, so I understand there's other pieces to this whole partnership with Trinity in the South End. So I guess I'm just concerned about what happens after September. And it sounds like that's still being worked out as to what's going to happen after September.
Correct. And the budget, again, this was an executive meeting through the NIPWA, which is New York Public Welfare Association. And they, again, it has to be approved. The budget has not passed as of yet. So
my last question, where would I go to find like an annual report or this? Would it be at Trinity or would it be at the other entity?
For the resource centers?
Yeah.
Yes, they do have an annual report, and they actually have a research design that they did. You have to do it every 2 years for this COPS funding. So I'd be happy to share it with you.
Yes, please. Thank you. Thank you very much.
Are there any other questions from the committee? Can we get a motion to approve?
Motion.
Lockhart, second, Mr. Bruschi. All in favor?
Aye.
Aye.
Opposed? Passed unanimous. Okay, now we're moving on to number 3, authorizing an agreement and amending the 2021 Department for Children, Youth and Families budget, Redlich Horowitz Foundation grant.
Thank you. Yes, if you remember at the end of 2020, it was November, we did get approved to accept the money for the Redlich Horowitz Foundation grant. This is really in efforts to prepare us for the Families First. This is when we need to decrease the use of congregate care and increase the use of kinship families and foster families. So this is an opportunity we actually have it twofold. One, to track our data through a software system called Tableau. And secondly, through having monies that can be used flexibly for families so we can recruit more individuals, as well as if there's any challenges with certification, if something doesn't come through, they need assistance with fixing a door in the house or other safety measures that need to be approved by the Office of Children and Family Services before they're certified. So that's what that money was used for. We were going to purchase the Tableau prior to, but there was a glitch with that because there's 2 different entities you could have. You could have like an in-home, in-house program, or you could have a server. So again, I wanted to review to ensure confidentiality and work with our IT folks. So if this does get approved to move it into the 2021 budget, we're ready to purchase those subscriptions.
Thank you. And I actually just want to acknowledge that Mr. Commisso has joined us. He joined us before we actually got to this item. But now I want to move on and ask are there any questions from the committee on this item? Okay, hearing none, is there a motion to approve?
Move.
Mr. Bruschi, second. Ms. McLaughlin, all in favor?
Aye.
Aye.
Opposed? Passed unanimous. Okay, number 4, authorizing the submission of a supervision and treatment services for juveniles program plan to the New York State Office of Children and Family Services. Commissioner?
Thank you. Yes, this again is the STSJP, the Supervision and Treatment for Juveniles Program. It's an allocation of $172,722, and it's a term of October 1st, 2020 to September 30th, 2021. And the Supervision and Treatment Program is to divert children safely from unnecessary placement or detention. And really, we want to reform our juvenile justice system, so we're not just putting children in the system, if you will. We really look at the goal of preventing out-of-home placement, maintaining that youth safely in the community, but also if that child does need to be placed, we want to look at reintegration to ensure that that youth has the skills ready to be successful in reintegrating in the community. Like I said earlier, much of the programming is for County Probation Department and Albany County Family Court juveniles. So I'll take any questions.
Thank you. And are there any questions from the committee? Hearing none, is there a motion to approve?
So moved.
Mr. Cleary, second. Mr. Bruschi, all in favor?
Aye.
Opposed? Pass unanimous. Okay, next item, number 5, authorizing the submission of a grant application to the New York State Office of Children and Family Services regarding child abuse and substance abuse disorders.
Thank you. The New York State Office of Children and Family Services just sent out a local commissioner's memorandum on December 8th of 2020. And this memorandum was really looking at, it's called CAPTA and CARA. CAPTA is Child Abuse Prevention and Treatment Act, and CARA is the Comprehensive Addiction and Recovery Act of 2016. And they are providing us funding for the next 3 years. They're indicating they will provide $90,000 in order for us to look closer at the substance abuse history and challenges many of our families deal with. They are providing this funding so we can hire a public health nurse. This public health nurse would be going out in the community with child protective workers, conducting a screening called UNCOPE, and it really identifies, do they have a history and a current challenge with substance abuse? They could also provide a full assessment, make referrals, but in addition, they would be, if a child is born positive toxicology, they would be doing a safety plan for that infant and ensuring that the services are provided to that infant. Many of our families are challenged with substance abuse, and this is alcohol and drugs, and we know it impacts the whole family functioning.
Thank you. And are there any questions from the committee? Hearing none, is there a motion to approve?
Motion.
Mr. Bruschi, second. Ms. Lockhart, all in favor?
Aye.
Opposed? Pass unanimous. Okay, number 6, amending the 2021 Department for Children, Youth, and Families budget, grant funding.
Thank you. Yes, this was another OCFS funded for Families First. Again, this is a heavy lift for counties to really not look at congregate care, but really how do we get more foster parents? How do we get more kin? And really looking at kinship, all family members, and really doing a better assessment there. So we were allotted $53,905. We didn't use it all. So what we'd like to do is roll that over into the 2021 budget, because it really does help keep children safely in their foster home or their kinship home. And, you know, again, we know being in the home is much better. So we did such things as assisted a family with daycare. We actually assisted with a pediatric appointment because they didn't have insurance as of yet. We actually, for our MAP classes, we paid for the Zoom. So those are just creative things that historically we haven't purchased. But with this flexibility and really thinking outside the box to say, how do we make it work? Let's think about it and let's achieve it. So these monies, which is $38,767, would assist these families in really expediting certification for either kin or foster families.
Thank
So
you.
this,
Ms. McLaughlin?
so this is really just a line transfer
Yes.
from, okay.
Are there any questions? Any other questions? Mr. Simpson?
Yeah. Do we have census numbers for daycare now under COVID?
I don't. That might be much more Commissioner McClave, because I could look for our children in foster care who's using daycare, if that's your question.
Yeah, I'm just curious about the concentration, what changes have been made, what's the saturation level under COVID, what are the number of child care facilities?
That might be something we have to ask the Right Side Up, which is the former Child Care Coordinating Council.
Could that be facilitated so we get those
Yep.
numbers?
Mhm.
All right, thank you.
Thank you. Are there any other questions from the committee? Do we have a motion to approve?
Motion.
Second, Mr. Bruschi, all in favor?
Aye.
Aye, opposed? Passed unanimous. Okay, next item, number 7, authorizing agreements regarding the Children's Advocacy Center.
Yes, the department requests legislative authorization to accept funding from New York State OCFS to continue to provide the support to the Child Advocacy Center. They have awarded us $159,560 for a term of February 1st, 2021 to January 31st, 2022. This would also include our agreements with Crime Victims Sexual Assault Center and the Albany Police Department to provide a part-time officer that assists in the investigation. And again, the Child Advocacy Center really wants to reduce the amount of trauma that is for the child in the actual investigation. So it's a way to bring all of the providers together in a less intrusive manner, going to a police station, for example, to interview the child. In addition, the Child Advocacy Center and Crime Victims, they provide a family advocate who really supports the non-offending sexual abuse individual. And they help the family navigate the system because it can be very, in a traumatic situation, it can be very overwhelming. So they really assist with all the linkages for the family. And again, the law enforcement is just there part-time, and it's a contract with Albany City Police.
Thank you. And so they don't have to go to the police station, they come.
Correct. And even they don't need to have all of the individuals in the room, like the DA and law enforcement. They can actually do it behind a glass window. And it also can be taped, so the child doesn't have to tell their story over and over to different providers.
That's good. Thank you. Are there any questions from the committee? Hearing none, is there a motion to approve?
I'd like to make that motion.
Lockhart? Are there any?
I'll second Ms. Lockhart's motion.
All in favor?
Aye.
Opposed? Passed unanimous. Number 8, authorizing an agreement with New York State Department of Health regarding reimbursement for administrative costs pertaining to the early intervention program.
Thank you. Yes. So it is a contract with DOH in order to get reimbursed for administrative costs for our early intervention program. And our early intervention program are for children birth to age 3 who have had a disability or in the process of being assessed for a developmental delay. And it could be anything from a physical delay to a cognitive delay, communication, or social delay. So this really just helps to offset some of our costs, because as the local government unit, we must administer the early intervention program.
Thank you. Are there any questions from the committee? Is there a motion to approve? Or Ms. Willingham, did you have a question?
This is a program that I've been very much interested in down through the years. And the one thing that I would like to know about the program, at one point, there was an assessment made of the zip codes that were being served. And I'm very much interested in that.
Okay.
Okay. And on the number of referrals too, and where the referrals are coming from, as far as the clients, the children are concerned. All right.
Yes.
And how many providers do we have now?
Well, we have independent providers, which, that's your OT, your occupational therapy, physical therapy, and speech therapy. There's individual providers that are contracted with, and you need to remember that they're contracted with the state because they took over fiscal agent, I want to say 5 years ago. And then we have center-based programs. So those are your achievements, beginnings, other programs. But I can get you an idea of our independent providers as well as our center-based providers. I can get you that. Do you want a list of the actual or just a number?
Please.
The list?
Mhm.
Okay. And I should say, I just wanted to add that with our single point of entry through our special needs, that they're identifying a lot more children that are in need of early intervention. So that number is out there. It's really for pregnant and parenting women or women of childbearing age, and it goes up to the age of 5. Because historically, we would get a lot of our referrals for EI through doctors and pediatric offices, but I think we've now expanded with the SPOE, so that has been a benefit.
Since you said that the numbers have gone up, when you provide the number of babies being served by zip code, okay?
Mm-hmm.
Can you look back over the past couple of years to see, whether or not this how it has changed as far as the number of referrals? And then is there a difference between the number of referrals and then the number of actual clients or babies being served? Can you tell?
Tell me more about that. Because
in other words, if there have been 50 referrals, have we had enough funds to actually, take care of all of the referrals?
Oh, yes. Yeah, but the one thing, I just want to make sure that when children are referred to the early intervention program, they get an assessment. So the family needs to select an evaluation team. When an evaluation team then assess the child, they need to be having a disability. It's not for children who do not have a disability. So that is the qualifying eligibility for the program. So a referral might come in and then deemed that they're not eligible. What we would do is be looking at other services such as our Healthy Families program or what the family may need.
Okay, you're saying that the referrals could be deemed not eligible? Is that what you just said?
Yes. They have to, because this is an early intervention program and the child has to have a developmental delay. And like I said, it's either through a physical delay, a cognitive delay, communication, or social.
And then just one last question. So at one point, this program was not advertised well, so that parents, actually knew of its existence. And have we kept up the advertisement of the early intervention program?
Yes, not as much outreach, because again, outreach, really, we're going to places since COVID and things being shut down. It hasn't occurred. We really are encouraging the SPOE in order to get, so we don't miss anyone. So it's anyone from a young teen who is pregnant all the way to 5 years old when they're entering school. So we're really trying to capture everyone so we have one doorway into the service system.
Okay. Thank you. Thank you so much.
Thank you. And are there any other questions? Is there a motion to approve?
Motion.
Motion, Mr. Bruschi, second. Ms. McLaughlin, all in favor?
Aye.
Opposed? Pass unanimous. Okay, next item on the agenda, number 9, amending resolution number 16 for 2020 regarding the provision of kiosks for SNAP benefit applicants and recipients. Commissioner Slade.
Yep, here I am, sorry. Coming. Yes, good evening, and thank you. We're looking to renew an agreement with Nano Nation to continue to install and implement our SNAP kiosks. There have been some delays, of course, during COVID to getting kiosks placed in the community. That has been impossible because really nothing is open. And we've also had some problems with setting up connectivity with New York State's welfare management system. So we're looking to extend the contract 1 additional year to February 28th, 22.
Thank you. And I remember when we passed this last year, something I was excited about is, we don't know with COVID how long this pandemic will really last. Are there any plans in place if things stay closed longer than expected?
Well, the most important thing to us right now is getting the connectivity with New York State welfare management system. We do have our kiosk installed in our reception area at DSS. So we're using that kind of as a template to see how things work. And when we get that going, we hope to, we'd have to figure out, because the point of having them in the community is so that people can access them on particularly off hours. So that would be nights and weekends. So you've got to have a place that's going to be open on nights and weekends. So unless there's libraries or an agency that has operating hours where we could have it, because of course it has to be inside and in a safe location. So if there's no place to put them, then we'll have a different problem.
Okay. What about a private business like Price Chopper, which at least before the pandemic was open 24/7, and we'll be going back to that at some point?
That could be if we really needed to, but we're looking for a place that can assist in managing these. So we're going to be looking for support from wherever we put it. So for instance, in a library, they have people who have technology expertise. So they're going to be able to help people use it. So we're going to need to have a commitment from wherever we place it that there's going to be people around and staff around to help people use it. That's our preferred placement.
Thank you. Have you identified sites yet?
No. As I said, we're looking at potentially library is one thing that comes to mind because of their hours of operation and because they have that support staff there who can help people use the technology. And then of course, we're looking at where the client base is. So we would want to put it in a population area where there's a high use of our services.
Okay, thank you. And Ms. McLaughlin?
Excuse me, but I apologize, but I'm not really familiar with this type of service, this kiosk. So when a client goes there, what are they typically looking for? What do they typically need if they're using this kiosk? And what do they, because I'm not familiar. I've never seen one. And if I did, I didn't know what I was looking at. So,
well, this is brand new. It's a new venture. And we're really trying something new to get into the technology age, basically, so that people don't have to come into DSS to apply, or they don't have to wait in line here to have their materials processed here. So it is a place where you can go online and apply electronically through mybenefits.ny.gov, which you can do right now from home. But this also allows you to submit your documentation. So if you have pay stubs, or if you have a birth certificate or a license or something that we need to have a copy of, you can scan it into this machine and it gets uploaded to our system. So, and then you get to keep your original materials. So it avoids you waiting in line, getting a copy made here, getting a receipt, and taking your receipt, taking your materials back.
Yeah, I mean, and therein lies the need for it to be in a place where someone could assist people.
Yeah.
Just because it's there doesn't mean people have the ability to use it.
Right.
And they could become even more frustrated than if they had to go into the office and wait on the line. So,
Yeah, they'll still be able to do that. We don't expect everybody to be able to use these. You're going to have a range of capacities for people who are comfortable with it.
okay, so I'd be interested in where you're exploring, because I don't think Price Chopper is going to work. I'm just going to tell you that. But
Yeah, we are looking more for community service agencies.
yeah. Okay, thank you.
Thank you. Mr. Simpson?
If somebody has a scanning capability from their home, is there a way to input through e or Gmail?
We no, we don't have that capacity, but we have, New York State has established New York Doc Submit, which if you have a smartphone, you can take a photo of your materials. You have to download an app and you can take a photo which gets uploaded of your materials, which gets uploaded to us. So there's all these new angles, hopefully, that people can apply if you can do it. I mean, if you have that, technology capacity.
Okay, that's even better. All right, thank you.
Thank you. And are there any other questions from the committee? Okay, hearing none, is there a motion to approve? Motion to approve. Ms. McLaughlin, second, Ms. Lockhart, all in favor?
Aye.
Aye.
Opposed? Passed unanimous. Okay, number 10, authorizing agreements with providers of home establishment furnishings.
Yes, we're looking to just add 2 additional vendors to our home establishment list. In October, we had, you had adopted authorization to renew agreements with Bass Furniture and City Discount Furniture, but we found 2 additional vendors that we'd like to add. And that is Furniture Liquidators and Homeless and Travelers Aid through their used furniture shop. They also have new mattresses, so this will be helpful to us to have additional vendors to allow clients to purchase home establishment furniture and equipment through.
Thank you. And are there any questions from the committee? Motion to approve.
So moved.
Mr. Cleary, second. Ms. Lockhart, all in favor?
Aye.
Aye. Opposed? Passed unanimous. And now the last item on the agenda, number 11, authorizing a grant application and an agreement with the United States Department of Treasury regarding rental assistance during COVID-19 and amending the 2021 Department of Social Services budget.
Yes, we're looking for legislative approval for to accept a $9 million allocation from the United States Treasury Department for rent relief for people who have been impacted financially and facing financial hardship due to COVID. So this was funding that came from the federal government, offered to municipalities that have more than 200,000 population. And it's really mostly to pay rent arrears for people who have been unable to pay their rent. And a few that can also pay for a few months going forward of rent. And this is to prevent homelessness, so to keep people in their homes who have had problems paying their rent during the eviction moratorium. So this is an addition of $9 million to the social services budget, which we were not prepared for because we just learned about it a few days into January and had a very short period of time to say that we would accept it. But we think it's a very good opportunity to help keep people in their homes because we're concerned about a lot of people facing homelessness if the eviction moratorium is lifted.
Hey, Mr. Fine.
Yes. Mr. Joyce.
Hey, this is Andrew. I would like to go on as a co-sponsor, please.
Thank you.
Make a note to council. Thank you.
Council, I would also like to co-sponsor.
Me
Yeah,
too.
Ms. McLaughlin, I see you had your hand up.
Yes, I'd like to be a co-sponsor, but I also have questions. And I don't know whether you have these answers or not. But so will the funding be going directly to the renter who was then responsible for paying the landlord, or?
The landlord.
Yeah, we are traditionally, and this would carry through to this grant as well, we paid the landlords or the utility company directly.
Okay, thank you very much. Because that's been posed to, that question was posed to me by some landlords who haven't been paid for over a year. But so thank you very much, and I would like to be on as a co-sponsor.
Thank you. And Mr. Simpson's next, and Mr. Cleary, did you also have a question?
No, I'd just like to be added.
Okay.
Thank you.
I'd like to be added, but also how soon will that application process be available?
That is a $9 million question. As soon as we can. This funding is for municipalities throughout New York State. In addition, New York State Office of Temporary and Disability Assistance received additional funding. And we just had a conference call with them on Monday that they're trying to develop a portal that everybody can use so that everybody has the same application throughout the state. And they hope to get that up by March. So we're not really looking at possibly starting applications until March.
Yeah, I got a call about the program today.
Yeah.
So I don't know if it's the best thing to have advertised before we had that available.
Well, we're taking, we do have an email and a number that people can call, and we're taking names and a little bit of information so that we can get back to people when we're open.
So can we get that information?
I'll send that out to everyone through Mike McLaughlin.
Very good.
And I see, I'm going to ask a quick question, but I see Mr. Riley, do you have a question? Then Ms. Willingham after. Commissioner McClave, I just want to ask, can you, when the system is up and running to apply, can you send that out to all of us, to all the legislators?
Yeah.
We can get it out to our constituents.
We'll be updating the materials, and it'll be on the county website as changes come. There actually, some of it is on the county website right now.
Okay, thank you. And Mr. Riley.
So thank you, Chairman. Just want to point out, this is not a question, more of a clarification. In the justification on the third bullet point, it says has a household income at or below 89% of the area median income. That's a typo. That should read 80%.
Thank you for that clarification.
That's it. Thank you.
Is that, council, is that something that we need to change?
Mr. Chairman, that's been updated on your tablets already. It's just that that's the version that was posted to the website has the previous information. Once we put it together for the full legislative meeting, it'll have the accurate number.
Okay,
Thank you.
And Ms. Willingham?
Yes, I have several questions. Thank you so much. First of all, I'd like to know, do we know what the area median income is?
I do have that somewhere. I'll have to get it to you. I can't, I think it's $70,000 or something like that.
So were we talking about $56,000 then?
Yeah, it's pretty high. So I just want to point out that when we did a brief assessment of who might be eligible for this, it's tens of thousands of people. So we're going to have to limit and prioritize who is going to be first in the queue. So from our perspective, it's the people that have been on unemployment insurance and are unemployed due to COVID, and those that, and even it says it in the Treasury instructions, below 50% of AMI. So 50% will be our first target, not the 80%. And then if funds are still available, we'll look to going to the 80% AMI.
Okay, all right. So then my next question is, can the owner apply?
landlords are supposed to be able to apply, but we have not, and these are questions that we have to look into with OTDA. We do not understand how a landlord can apply. They must provide information on the tenant's situation. So the tenant's income must be attested to. So we have to work that out, how that would actually occur.
Okay. And then I see, how are you going to split the rental dollars versus the utility arrears dollars?
Well, I think that there'll probably be more rental requests than utility, because there is the HEAP benefit and people have been using that all along for utilities. So there's quite a good amount of funds in the HEAP program. So anybody who has had utility problems should be coming to us anyway. This is a little bit more generous as far as eligibility. So we could have some. So we would direct them to HEAP first. And then if they're not HEAP eligible, it depends on what the situation is. If it's going to mean that they're going to get evicted if they have no electricity, then we would probably look at that. So it's going to be on a case-by-case basis, I would think, for utilities.
Okay, so I just want to go back to this one question. You're saying that the application includes the renter's financial status, and that the landlord may or may not be able to provide that? And is this, and this is my last one. Are people who are on Section 8, are they, no, they're not eligible.
They're not eligible. Anybody who is receiving public housing assistance through other methods, this is not the program for them. And this is not a program for mortgages either, for people behind in their mortgages.
Okay, thank you, Mr. Fine. Thank you, Ms. McClave. Thank you.
Thank you, Ms. William. Thank you, Ms. McClave. Great. So could you just continue to keep us updated as you find out more information and as you develop a system in place to for people to apply?
Absolutely.
Thank you, Commissioner. Are there any other questions from the committee? Hearing none, motion to approve. Ms. Lockhart, second. Mr. Cleary, all in favor?
Aye.
Aye. Opposed? Passed unanimous. Okay, so that was the last item on the agenda. Is there a motion to adjourn?
Mr. Chairman,
Yes, Ms. Lockhart.
can I just take a moment? I just wanted to recognize our colleague, Ms. McLaughlin. I found out through my daughter-in-law, who was working with you this weekend, you were down there volunteering your time, giving vaccines out at the church. And she spoke very highly of you. And I just appreciate that you're down there volunteering your time and doing that, getting that community vaccinated.
Thank you so much. That happens to be my church home.
Oh, okay. Okay. Well, good.
Thank you, Ms. Lockhart, for acknowledging Ms. McLaughlin, and thank you, Ms. McLaughlin, for your efforts. It's much needed during this time. We all appreciate it. Do we have a motion to adjourn?
Motion.
Mr. Cleary, all in favor?
Aye.
Opposed? Okay, a meeting is adjourned.
Thank you.